Hello everyone, this is Dr.K.V.N.Rajesh, your host for the podcast that we are doing since long time. Today we are going to discuss a very crucial topic, that is all knowing about the root cause of illness, which is called as functional medicine. So we have an expert in this area, Dr. Ashwani Garg, who will be educating us in knowing about the root cause of any kind of illness. But today we are going to discuss the most threatening issues globally, that is all about diabetes and high blood pressure. So these are very common among all the people, not only in the older generation people, even for small children, adults, middle-aged people. We are all observing that this has become a common problem. So we are not targeting on the most important parameter, like why it is happening to me, why this problem is affecting me. That is what we are going to discuss today. And Dr. Ashwani Garg is an expert who is mainly into the area of functional medicine, longevity, chronic disease reversal, brain health, and many more, who is going to discuss about the topics that I have mentioned. And only one thing I want to tell you is, if you really like this podcast, do like it, comment it, and share it with your near and dear, so that they will also get educated in this aspect. So, not wasting your valuable time, let us jump into this session. So, thank you, Dr. Ashwani Garg, for sparing your valuable time. So, can you kindly introduce yourself to my audience?
Thank you so much, Dr. Rajesh. Really appreciate your time and effort in educating, creating that awareness. I'm a conventionally trained doctor, but currently practicing this functional medicine. So, conventionally in medicine, we are trying to see this is a symptom, this is a diagnosis, and this is a drug for it. But there could be so much down the stream happening in the body, which is manifesting as diabetes, which is manifesting as hypertension. So our job is to figure out the mechanics behind it, the reasons behind it, the root cause behind it. And my area of work, typically, I work with autism, I work with autoimmune problems, and of course the metabolic disorders. So these are the primary three, four key areas I work with.
No. So, Dr. Ashwini, I wanted to know, how does functional medicine approach diabetes differently from, sorry, I will cut this. So, Dr. Ashwini, I wanted to know, how does functional medicine approach diabetes differently from conventional treatment methods?
Right, sir. So conventionally, we follow algorithmic approach, which means when blood sugars are high, the first line of intervention is metformin. Second is a drug to increase your insulin, which can be glimepiride or GLP-1 drugs. Third, if that doesn't work, I say, let me slow down your digestion. So one of the drug called Boglibos. Another, if still doesn't work, I say, let me excrete some blood sugars from your kidneys. If still doesn't work, I say, okay, Baba, you are on pancreas, insulin. Okay. So this is how the algorithmic approach, but we never see what is the problem there. Why the blood sugars are not getting optimized for the person. Now, in functional medicine, we try to see what is the problem in the first place. Type 2 diabetes, typically when we test people, the pancreatic function is okay. Pancreas is not a problem, but the machinery, which is your mitochondria, is not optimally working. Example, it's like a car. You have an engine and a fuel tank. You have fuel, but engine is not able to convert the fuel into energy. So similarly, the machinery of the body is your engine, the mitochondria is not optimally working. Okay, because of that, blood sugars that we consume as a food is not getting burned into energy. So resistance of insulin or poor metabolic function or poor mitochondrial quality is primarily the reason behind type 2 diabetes. So then we're trying to define what are the reasons behind this poor metabolic function. It could be that we don't get enough sunlight, we don't get enough sleep, which is important as a metabolic trigger or a way to repair the mitochondria when we sleep. It could be the body is dehydrated because of that mitochondria action is poor, because of that blood sugar is going high. It could be that I'm just overburdening my body with a lot of fuel and my over beyond the capacity of the mitochondria. It could also be some infections are going on in the body, chronic infection, which is impacting the health of the mitochondria. It could be nutritional deficiencies, as simple as that. Let's say B vitamins, magnesium, zinc, protein, things like that are missing in the body. Because of that, engine quality, repair, regeneration is impacted. Okay, it could also be some microplastics hindering the biochemical, mechanical actions in the mitochondria. So all of these reasons could be causing metabolic dysfunction, consequently mitochondrial failure or dysfunction, consequently resistance of insulin, consequently high blood sugars. So we want to see what is the mechanics in each individual which is causing the problem, thereby type 2 diabetes and blood sugars are high. So we want to delineate the reasons behind the problem.
Yeah. So in this context, I wanted to know, can type 2 diabetes truly be reversed or is it only manageable?
Well, I think science is ample clear. Type 2 diabetes, pancreas is fairly okay. It's a resistance of the insulin. And we can fair square reverse type 2 diabetes without a problem, as long as the person is willing to make a change. If person is willing to make a change, type 2 diabetes is 100% reversible case.
So here, Dr. Ashwini, I wanted to know, for example, one patient is there
Yeah.
and is diagnosed with type 2 diabetes. So what kind of treatment difference do we observe when the person approaches a normal doctor and a functional medicine doctor who is specialized in that area? So what kind of treatment differences do we observe?
So, well, type 2 diabetes, as we know, is a lifestyle problem. And it can be corrected by lifestyle medicine or lifestyle interventions only. Now, when we go to a conventional endocrinologist, there, like I said, first action is metformin. If metformin doesn't work, then we line up other treatments. But we might, in functional medicine, don't even use metformin in most cases. We say you first change your lifestyle, then you change your diet, reduce your carb intake, increase your protein intake, eat two meals instead of multiple meals, don't eat very late in the night, sleep at the right time. Even these basic interventions can take away your diabetes in most of the cases. Beyond that, we want to test them. Is there any infection going on? Is there any deficiencies in the body? Is there any toxicities in the body? Things like that. And then we want to resolve these problems. And we don't want to give a drug. We want to resolve these matters, which is causing that metabolic dysfunction. And as we do that over 3 6 months, the person is out of diabetes most likely.
Okay. So here, causes of high blood sugar that people often overlook.
Well, like I said, first and foremost is what kind of diet we are eating. Let's say structurally, our bodies are primarily made of the fat and protein and phospholipids. And carbohydrates come as a raw material, which is kind of fuel to the system. Now, before I can burn my fuel, I need to have a structurally healthy body. But today, what has happened in Indian diet, where largely carbohydrate intake is there. We hardly eat any proteins, I hardly eat any fats, I hardly eat any phospholipids, mineral vitamins. We're largely eating white rice with a little bit of curry, with a little bit of dal. So what happens over a period of time is structurally your mitochondria becomes weak. Or ability to replace the old mitochondria with a healthy mitochondria is compromised. Now you see, you have a poor engine. You had a BMW engine initially, now it has become a Maruti engine. Your mitochondria quality, quantity, number, all of that has reduced, which is a problem. So our interventions first level is this basic changes in the diet and lifestyle, and that should do the trick.
So, do you advise a normal person, even without getting affected with this kind of type 2 diabetes or some other issues, is it good for a normal person in general condition to meet a functional medicine doctor well in advance and take some advices, make some lifestyle adjustments. So will it work in reversing these kind of problems, Dr. Ashwani?
Yeah. So certainly, Dr. Rash's first level is we want to prevent the problem. A healthy person should remain healthy. They should not get into problems. So as we age, we're losing more mitochondria as a natural process. But then if we don't keep a good lifestyle and food, we will age faster, which means disease will come faster. So if a healthy person comes to us, we will maintain their health and don't let them get into a problem. If they are into a problem, our job is to bring them back to make them stable.
Yes. So here I wanted to know, like, how much impact do diet, nutrition, and weight management have on reversing diabetes? You already told them, but in particular, say for example, a person is having a chart kind of thing, daily chart, weekly
Yeah.
chart.
Yeah.
So that kind of analysis will that person does. And let us say in that family there is a diabetes issue going on hereditarily. So can that person be out of this danger?
Well, type 2 diabetes, there's hardly any hereditary about. Okay. It's just you and me and everybody living in the same families, eating the same food, living the same lifestyle. That is the part of the hereditary rather than the genetics. Okay. So if we change our diet, if we change our lifestyle, you change your food, you change the way you do things, you will not get problem, or if you have a problem, you should be able to fix it. And early on, before it becomes too late, if you do that as a young person, then you can certainly reverse your problem. There's no doubt in my mind. It's absolutely clear.
So here we are seeing that nowadays people are with lots of stress,
Yeah.
and as you rightly told, sleep is also a kind of issue with so many people. So what role this stress and poor sleep play in raising blood sugar levels?
Well, stress will increase your cortisol, and cortisol will increase your blood sugars. When you're stressed, your digestion gets compromised, your enzyme production in the stomach gets compromised. When that happens, your digestion gets compromised, your nutrition to the body gets compromised. Even though you're eating, under stress you don't digest and nutrition gets compromised. When you're stressed, your immune system gets compromised, you have more chronic infections. Now you see, just stress can increase your blood sugar, can increase your infections, can increase your nutritional deficiencies, and all of them eventually affect your metabolic activity. Now, sleep is a time when body goes into repair. Now, daytime sunlight falls onto us. It's a trigger for metabolism, start activity in the body. Now, when we are under darkness, that means there's no sun falling us, and we are under darkness. We are not under artificial lights, and we are sleeping well. This is where body will replace the old mitochondria, old cells into no better functioning quality cells. Now, if we don't get enough sleep, we don't get enough sun darkness in the sun after sunset. We're literally running on old faulty cells. Now, old faulty cells means disease, means metabolic dysfunction, means high blood sugar, means hypertension.
So, stress, how do I know that I'm being stressed? So there is no measurement kind of thing. Like for BP, there is a machine to measure it.
Yeah,
For sugar, there is a machine to measure it.
yeah.
So how will I know that I'm stressed?
Well,
Some people, they don't even know that they are stressed.
yeah.
That is the reason why I'm asking this question, doctor.
No, fair point. Nowadays, luckily, there are enough tools, and one of the tool is called heart rate variability (HRV).
Oh.
So now people have these rings around their fingers, which are connected to their phones, and they have very very powerful sensors in them, and they can know your heart rate variability. Now, if your heart rate variability is reducing, that means you are being impacted by the stress largely. So maybe if I 5-7 thousand rupees ring can help you know your stress levels and how you're doing, and how different situations are affecting your body and stress, things like that. And you can probably do better if you know what is affecting you more.
Okay. So this test, will they do it for the entire day, doctor? Like how they do that?
No,
Like, is it a
well,
random sample?
no. Well, it's not a sample. It's just a ring that you have to buy.
Oh,
You just buy a ring and keep it on finger, and then you that is connected to your phone, and you keep getting the
oh,
data every day. It's very simple.
okay. Mhm. This is a good point to know. Actually, doesn't measure stress. They measure diabetes levels. They measure BP levels. But yeah, this is very good point, doctor. Now here I wanted to know, like, for someone newly diagnosed with diabetes, what first steps can they take towards a reversal?
Right. The first is defining the problem. It's very important. Is it type 2 diabetes? Is it one and a half diabetes? Is it one diabetes? Okay. Now, type 2 diabetes by definition means a mitochondria problem is there, but pancreas is largely okay.
Oh,
Type one and a half diabetes means pancreas is running at a 50% capacity. One means its pancreas is completely gone and you need external exogenous insulin. Now,
oh,
first, we need to define the problem. If it is type 2 diabetes, where as your blood sugar will go up, your insulin should also be high, much high.
mhm.
So, this means your pancreas is trying to compensate for the resistance. Now, this is the case when your fasting insulin is high and sugars is high, then you know it's type 2 diabetes. This is where you test yourself for your nutrition, you test yourself for toxins, you test yourself for chronic infections, change your diet lifestyle, and you fix your these problems. You remove the toxins, you nourish your body, you clean your digestive system disorders, and 3 6 months you're okay. But if you have pancreatic dysfunction, then probably first level you can move into keto diet. In keto
Oh,
diet, your fuel is largely ketones along with the sugars. Ketone don't need insulin. So if you have an insulin deficiency, probably a keto diet will help you manage your blood sugars better. But then if you are not for some reason get into keto, but then you need some insulin alongside, plus you need metabolic correction in your body.
okay. So, another important part of our discussion, that is high blood pressure. So, how does functional medicine address high blood pressure beyond just prescribing medication? As you know, this is also one of the most global common issue nowadays.
Right. So well, if you look at hypertension, it's like your blood vessels are becoming more brittle, right? There has to be multiple reasons which is making the brittle. Uh, One of the reason is there's inflammation in the body. It's the same inflammation triggers or toxins. They end up doing a damage to your endothelial line in the arteries. Now, damaged endothelial line means this less ability to produce nitric oxide. Thereby, they don't dilate. So, if we reduce the inflammatory triggers, if we reduce the problem in the body, if we reduce inflammation in the body, maybe the vessel can repair. Endothelial lining can repair. Thereby, it can retain the flexibility. Second possibility is lack of magnesium itself in the body can cause brittleness or loss of elasticity in the blood vessels. So, if magnesium is low, you supply the magnesium, elasticity can be maintained. Now, sometimes what happens over a period of time, due to some inflammatory cascade, you develop calcification in your arteries. So you reduce your inflammation and you decalcify your arteries through vitamin K2 can decalcify the arteries, for example. Okay. Or we can do chelation where we can remove arteries, calcium from the arteries. That also can help you potentially regain your flexibility. Now, in the muscle, there's a muscle in the wall, smooth muscle in the wall, and the muscle flexibility also depends on the mitochondria. If you improve the metabolic function, mitochondrial function, probably the muscle become more active, and again it can maintain the flexibility for you. So, so it just we need to make it more flexible.
So, say for example, one person is there, Dr. Ashmi, in the sense that person got affected for this issue, BP issue, say from very early age, say early in the 30s, and is under treatment and doing regular exercise and all. taking every care in terms of diet and all those things. So, do you think this problem that you have mentioned, will it be in controlled state, or is it going to slowly damage the overall functionality of the body? What do you say regarding that?
Right. No, so drugs are more symptomatic,
Okay.
right? Now, drugs don't fix the problem, they are like a patch up. Now, if you are maintaining your blood sugar based on your drug, which is not a problem, it's good to do something, at least something. But then the triggers which has led to the problem in the first place are still there or still increasing. That means damage is still continuing. We're able to manage by increasing the dosing and all that. But the triggers are still there. So that means we're still progressing the problem. Problem is not halted. It is not on the surface because of the medication.
Okay. So, coming to this high blood pressure problem, are there cases where high blood pressure can be completely normalized without long term medication? Because, there is a kind of saying and implementation that once the BP tablets are in use, they have to be prolonged way, they have to be used in a prolonged way. So, what I'm trying to ask is that if there is a chance that in functional way of treating this problem, can BP be completely normalized without long term medication?
Well, if a person comes to us early on, person is young, let's say 30 years old man with 2 years of history of hypertension and willing to follow the regime to become healthy, to nourish the body, certainly we can put them off medication. But if a person comes to it at age of 65, 70,
Oh,
not able to follow as much as we want them to follow, then probably we can reduce the dosing of the drugs. So depends on the extent of the problem and how much somebody can follow it. So repair of the body is a lot of work by the person and it becomes expensive also when we're trying to repair it. Management is more cheaper.
exactly. So, Dr. Ashwini, what do you say to a 30-old person as you took the case one? So, what kind of uh, life activities do you prescribe them? What kind of changeovers do you prescribe them so that they will be totally away from this lifelong medicine for BP?
So, well, I think Dr. Rajesh is nothing special we have to do. It's the same metabolic function which can cause diabetes and which can cause hypertension. So sleep well, sleep at the right time, get a lot of sunlight, get a lot of physical activity, eat nourishes food. Basic. Beyond that, if this is not enough for individual, then we can test them. So let us say a lot of time we see people with lead in the body. Lead can cause more mitochondrial dysfunction, thereby hypertension can happen. So if my house has a battery, which is inverter battery, which is fuming out lead, and I'm sleeping next to it, I have more lead in my body. That can make my blood vessels more brittle, right? So if we test these cases and see is lead a problem, mercury a problem, aluminum a problem, or magnesium deficiency a problem, or carnitine, CoQ10 deficiency a problem, whatever the basic nutrients are missing in the body, if we know that, then we can do further work on them.
So here you mentioned a new point about lead, Dr. Ashwini. How to know my lead levels in the body? Is it
Well,
like a common blood test will resolve it, or something to be done?
well, we can do a serum blood testing also. You know,
Mhm.
almost all my patients we do lead, aluminium, mercury, arsenic, barium,
Mhm.
cadmium, strontium. We test all of these heavy metals in them for any of our patients. So a common blood test. Thyrocare has this testing done at a cheaper price, but a lot of labs can ask 30,000 rupees, 40,000 rupees also for that.
Oh,
So Thyrocare can give you for 3-4,000 rupees of data, but you need a right doctor to interpret them and to help you excrete them from the body.
that's very nice, doctor. And I wanted to know, like, What underlying causes of high BP are often missed in regular health checkups? I think
Well,
you answered them in our discussion, but yeah,
yes.
just wanted to know. Yeah.
In the regular prescription, we just test the BP. We
Huh.
don't even test multiple times. We test it one time, and if one time its BP is high, we say you are hypertensive and you need to be on drugs. We hardly look at the problems behind it. So uh, I think simplest of simpler, get more sunlight and get more sleep is the easiest way out of the problems. Now, if we scrolling our screens, sleeping at 2 a.m. in the morning, we certainly not l- allowing our body to repair. So that is could be the biggest reason that we are suffering from.
Okay. So here I wanted to know, like, at what time we should take the BP measure, Dr. Ashwini? Like, some say you go early in the morning, take it. Some say in the afternoon. Some say in the evening. So, what is the correct time to take the measurement of blood pressure?
Well, I think most importantly, when you're relaxed. If you're relaxed in the morning, you're not worried about things. You calm down. You have done some pranayam, some meditation. Whenever possible, you do that. You calm yourself, and probably you get decent numbers. Okay. Now, body is a dynamic system. It cannot have a same values at all the times. So don't worry
Yes,
about
yes.
little 5 units up and downs. But if you are in a relaxed state and you do it for 2 3 times, and if consistently it is high, then means okay, there's a problem.
Yeah. So, there is another myth, or I don't know. I want to clarify from you. But like 120 by 80 is the magic figure we should maintain every time. Is it really attainable, Dr. Ashwini? Like,
Well, in real practice, sometimes we see 110 70 person is doing great. Sometimes we see 130 85. There's no problem, all the kidney function is okay, everything is okay, rest of the thing, inflammation is okay, person don't have any problem. So there could be variables, there could be outliers. Okay. So every individual we need to see individually rather than just trying to put them into some category and buckets. Oh, you are beyond 120 80 and either you are hyper or hypo, things like that. We need to see if that number is suiting that person or not.
yes, exactly. So, in this context, I wanted to know, like, stress management. Again, I'm coming to the same point. Uh, that's a common factor which we have to take in this current, what we say, digital world and very fast life. Will it going to affect our long-term blood pressure control, doctor?
Your stress can make your arteries more brittle, for sure. And see, well, we are just worried about life. What has happened yesterday, we're worried about today, we're worried about future, which has not even happened. And we're causing ourselves trouble for no reason.
Exactly. So finally, I wanted to know, for someone with a family history of hypertension, what preventive measures can functional medicine offer? Uh, what do you say regarding this? Like, ancestrally, grandfather, father, everyone has blood pressure, and this kid who is born in this family. So, what can that person should do? As you already told, it's not ancestral; it's lifestyle kind of thing. But again, I'm repeating the same question in
Yeah.
this context of blood pressure.
Well, I think we had to reduce our sugar intake, carbohydrate
Oh.
intake. Okay. We need to be more, less worried. Just because our family has some problem doesn't mean I should get or should not get. The
Mhm.
stress itself. Now this is another problem in the system. Just because my family has it, I'm told, oh, you will also has it. Now I'm on the loop, my mind is in the loop. Oh, because my father has it, I must get it somewhere, right? And then because I'm told that I will get it, my mind will manifest it. So I had to de-link my mind from that. Whatever in the past has happened to my family is fine, but I should take care of myself. Okay. That thought itself is scary, I tell you. But yes, it's good for the industry. Industry is happy with it, right? One thought, and one person is manifesting, another generation is manifesting a problem, third generation is manifesting a problem, just because one thought is there. So a lot of these times are just lifestyle problems. They has hardly to do anything with genetics. Unfortunately, we have made a big fuss. Human genome cannot be so weak. We humans are here for thousands of years. How can today, in last 30, 40 years, it has become bad that everybody is getting every family problem, right? So I think we need to delink that.
Superb. That clarified all the good important points in a very simple form so that whoever listens this episode will come to know how to deal with these kind of issues in a better way. Thank you so much for sparing your valuable time and educating us, and so good to meet you and interact with you, Dr. Ashwini.
Thank you, Dr. Rajesh. Thank you so much.
Yeah. Thank you so much.